We've got a couple people in the room here. Thanks for bearing with the technical difficulties, I guess, conferences in the time of Zoom. So I'm really thrilled to be talking with you today. I'm Caitlin Augustin. I'm the Senior Director of Product at DataKind. And what my presentation is really about today is the art of the possible. So looking at ways that data science, machine learning, and AI could be used, could be deployed to have positive social impact. If you throw questions in the chat, glad to try to answer them as I go. Again, know this is going to be a little bit of a speed conversation, so that's totally fine. I have slides that you can access my slides later. I'm glad to share them with everyone. Here, I'll just put them in the chat now, and glad to just have a bit of a conversation. So, DataKind is a global nonprofit with the mission statement of using data science, machine learning, and AI in the service of humanity. We do this through working with partner organizations who are already implementing solutions or interventions for positive social impact. And we believe that data science has a role to play in augmenting those already great interventions. We like to work on wicked problems. So if you're a programmer, you've probably heard wicked problems talked about quite a bit. But the oldest definition of wicked problems is just this problem that is difficult or impossible to solve because of incomplete, contradictory, changing requirements that are often difficult to recognize. We can't say that we've solved a wicked problem. For example, we can't say that we've solved poverty. But what we at DataKind believe is that we can use data science to help mitigate or help tame some of these wicked problems. And we do this through partnerships. So we help social organizations identify their data and AI opportunities. We do this through Discovery Day events like the one that we'll be holding with NYU and or with other partner organizations. We hold them pretty regularly. And this is our first step to identifying problems and identifying the potential opportunities. DataKind works through a mixture of staff and pro bono technical experts. So we pull together a team who will work on this problem that we've identified. We can work for hours, days, weeks, or months, depending on the complexity of the problem and what we're hoping to solve. And then once we've created a tech solution, we stick around to make sure that the solutions are useful and impact is ultimately achieved. So we do this, I mentioned, days through hours. So DataKind runs something that we call impact practices. So impact practices are like this equivalent of a standing academic lab. These are ongoing cohorts of projects in particular thematic areas. So we convene multiple stakeholders to work on problems that reach across a sector. And we keep those projects in those thematic areas going year after year. We run individual project programs, data core. So this is a one-to-one relationship between DataKind and a partner organization to help identify and create a solution to one specific issue. We run data dive events, which are our first step in our data core process or our first step in our project process. These are great for exploration, prototyping, the initial analysis. And we also do community events like our Discovery Days, which are the first step, quick consultations to identify how data science might be used for social impact. Now, DataKind works across the globe. We have chapters in multiple locations. I'm talking to you from DataKind's global chapter, which is run by our staff and encompasses volunteers from around the whole world. But we also have chapters in Singapore, Bangalore, the United Kingdom, Washington, DC, and San Francisco. And we've done over 300 projects across the globe. We have over 20,000 community members. We've completed 350 plus projects. And the number that I think is pretty astonishing is that DataKind has been able to, through our volunteer community, provide over 200,000 hours of volunteer services. And I see that we have some notes coming in, but I'm also going to add, just for the new individuals who've popped in, sharing my slides in case we don't get through them all in this conversation. So The way that DataKind works is that we believe there are 6 components to a data for good solution. And this has been borne out over our hundreds of projects that we've completed. And you'll notice that data only shows up in 2 of these 6 components. So to do a successful data for good project, yes, you need data scientists. Yes, you need data sets. But more importantly, you need social actors who deeply understand the community that is going to be impacted by these solutions. You need subject matter experts who can talk about the intervention, who can talk about the ethics of the implementation. You need funders who are willing to commit to take a risk on what's likely a new program, likely a new approach to solving a particular problem. DataKind's really lucky to be partnered with organizations like the Rockefeller Foundation, who have recognized that you need transformative investment for transformative impact. And they have been really at the forefront of encouraging thoughtful use of data science technologies. But perhaps most importantly, you need a problem statement. You need to understand, why am I even undertaking this conversation or this approach to data science in the first place? This problem statement helps, at DataKind, we say, we start from what keeps you up at night. It doesn't have to be about data. The worst thing you could almost do is to say, I'm going to start my problem conversation with the data I believe I have on hand. You want to start the problem statement from what's preventing you from achieving the world you want to see. And then we can work backwards to see how data science and data could be used to solve that. Now, we really build these problem statements because we talk about, what do we want to do with data? And there's, I really love this visual of all the different ways we can use data. So each step in this cycle of observing the world, reasoning through the world, acting in the world, each of these steps are a place where data and data science are vitally important. And they are cyclical because one is not necessarily more mature than the other. Organizations can enter this cycle at any point. You start with observation. What is the state of the world? In this case, you might be identifying data that's available to you, accessing that data. Do you trust that data? And if the answer is no, I don't have data trust, data science can help solve that problem. And I'll talk to you a little bit about an example of work that DataKind has done with the organization Medic to build out machine level data trust. You're reasoning through the world. You say, okay, I've observed the state of the world. What's going to happen next in my world based on my understanding of the world? You start to understand data, you can anticipate outcomes, process how to take next actions. So if you have an observation, have a map of the world, and perhaps you're trying to predict where drought might hit next. Reasoning would let you take all of your current observations of the world and to anticipate that next step so that you could then act. So once you've reasoned through, you might say, I have an understanding of where the world is. I've observed it. I've reasoned through what might happen next. And I want to take action. I want to change something in the world to get closer to that goal. So I want to provide my intervention based on what I am anticipating the outcomes are. So this is a chance to propose solutions and identify new opportunities. And once you've acted, you need to go back to observing in the world. So this is, I think, just a perfect cycle that really underscores that any organization likely can benefit from an understanding and an approach to data and data science, regardless of maturity. I'd also note that none of this is about your data collection. Observations of the world can be built on public data. We're at a Data for Peace conference. UN OCHA was one of the speakers. There's so much public data available through the Humanitarian Data Exchange. I know Facebook is another speaker at this conference. Facebook has made open so many different COVID-19 data sets. So all of this can be done based on open source, open access data sets and data solutions. So DataKind, when we approach a problem, we have 3 design principles that we hold most dear. And I want to emphasize these for anyone embarking on a data journey. The first is that your data scientist or your technology team needs to learn from experts and needs to listen to all voices. At DataKind, when we started our work in frontline health systems, we had over 100 conversations with organizations working across the frontline health space. Because we at DataKind, we weren't the experts. We needed to learn from the experts, from the individuals on the ground, to ensure that we were creating solutions that made sense, that were contextually appropriate. I want to focus on leverage points for systems change. I'm a data scientist and an engineer, and I have a bias toward thinking that data science and engineering are solutions to many problems. And that's true. But data science and engineering are not the solution to every problem. And it's important to know that just because they are new, they are flashy, funders like these new approaches of AI, machine learning, they're not the solution to everything. There are problems that can only be solved with more funding or more political will. I mentioned frontline health systems. The first pain point that DataKind discovered and routinely came up was the fact that we need to pay frontline health workers. If you don't pay CHWs, you can't use data science to suddenly make CHWs make money. So we had to think of what leverage points made sense for data science. And in our frontline health systems case, it was like with the data that was already collected. And then the third, and really, I think the most important step to take here is that ethics, privacy, and risk management need to be prioritized from the start. We are privileged to work with this data. This is something that DataKind UK held a whole workshop around and really drove DataKind's point of view, that we are using data in service of other actors. So it is important to know that the community that is being served understands what data collected upon them is being used for and have agency and understanding about that data. It's also important to know that each solution that we make has consequences. And some of those consequences might be good, but some might be unintended and negative. I'll give an example that DataKind was in frontline health systems, which is an area we've been working in pretty deeply. We were talking to a partner and we said, you know what? Optical character recognition, image detection, this idea of taking a picture of a file, applying machine learning to it and extracting text out of it. That's a process we have figured out. We have created those tools. We could help you with this, partner. We can say, here's your image detection solution. You can take all of those vaccine records and you can digitize them. And our partner said, that's great. It's wonderful you've made that solution. I employ 20 people in this community doing my digitization. Implementing your solution would put 20 people out of work. And my ethical commitment to my community is that I am providing these jobs. And that's just a hugely important factor to say that we are data science, machine learning, AI can optimize for many things, but they need to be contextually appropriate and they need to fit within the space that you are working within. I see there's just a chat coming in. Let me quickly, okay. So I'm going to keep moving forward here to just tell you a couple of examples. So DataKind recently worked with CareOxfam and Save the Children on identifying areas that we could bring together these large data sets. So for organizations early in their data science journey, this is a really interesting problem. We came to this problem saying, the data tells us that hunger is on the rise, internal displacement is at highest level in decades, severe weather is more common, and disease outbreaks are increasing. And these are huge gaps, and yet we don't have an accurate understanding of all the data available here. We had this suspicion that we could pull together big data, that data sets from the IMF, from the World Bank, from Facebook, all the presenters that you've been hearing from throughout this Data for Peace conference, that we could bring all of this information together to create a common picture of needs. But, how do you do that? How do you bring together hundreds of data sources to help this particular consortium? How do you use that to then make decisions? Well, you need a data science or an AI for good approach because you need the ability to build out systems that can extract this information. If one human is tasked with trying to find and synthesize all of this data, you do not have the ability to then do a proactive response or an emergency response. This is taking an AI for good approach and pre-building all of these data streams allows you to be anticipatory. And so what we did over the course of a weekend, this is just one example of a map that we built, is we mapped the common keys across 8 data sources, which allowed us to bring together thousands or countless data sets with that same data structure. If you could actually go from the common linkages between data set to data set. Because we were able to build those linkages, we were able to develop insights around population movement, food stress, and other key decision-making points for humanitarian actors, which really showcase the value of that approach. So this is just one example of a map that we built of looking at human migration during COVID-19. And this project's ongoing. So if it sounds exciting to you, we are continuing to bring in data sources and we're making this tooling accessible through things like APIs so that more organizations can deploy it. And we're looking to continue to move forward to building out to more computationally intensive data sets. So that's one example of the art of the possible using data science, machine learning, and AI in the humanitarian context. I'm going to take you to a far different problem here. So in this case, rather than saying we want to start and we want to see the data available, we actually had a very specific ask. In this case, DataKind worked with the organization Soil Haiti to do optimization for waste management. So Soil Haiti works in Haiti across the country with doing container-based sanitation. So they have toilets that are completely self-contained, that are delivered to homes on a regular schedule, picked up, and then transported for waste management, cleaned, and then redeployed. And you can see this picture. This is one example of one of the vehicles that they used to do this transportation. And they had this real problem that logistics and transportation costs are their biggest bottleneck. And it's they had to build new routes each time based on uncertain road conditions. And because of trying to adjust routes each time, they didn't use their vehicles to full capacity. What this means is if you have, in Soil's case, they had wheelbarrows, they had ATVs, they have pickup trucks, and each of those can hold a certain number of toilets, but they weren't optimizing to fill and send the appropriate vehicle out at capacity to do a route. And because a human was actually identifying the routes each day, they weren't optimized to have a logical number of neighborhoods to visit. So these are just some pictures of the different routes that humans were drawing and designing for their regular pickup and delivery. Now, what DataKind was able to do is we were able to take all of that customer data. We were able to solve what's called the capacitated vehicle routing problem, which we were able to say, here's the capacity of each of these vehicles. Here's the locations that these vehicles need to go to. We want to optimize for the shortest time and the shortest distance traveled with the maximum amount of delivery. And we were able to do that and build a tool that output that route on a daily basis, along with turn-by-turn instructions that were all accessible offline. So this is what it looked like. So rather than having an individual human saying, okay, I'm going to write out my route on a daily basis, we were able to take all of these inputs and put out a structure of routes and stops for an individual driver to visit with a particular vehicle, which is pretty amazing. And Soil Haiti has been implementing this solution, and it saved them over 10% of the routes that they had and the distance that they had previously traveled, which is a huge time and cost savings for them. And so that idea of DataKind sticks around, we started this project back in 2018, and we continue to work with the partner to collaborate and adapt to COVID-19. And in this case, we actually worked to help integrate another workflow that Soil was able to develop with a completely different partner, with TerraWorks. So we were able to integrate a new tool and a new workflow to meet the current challenge. And in this case, they needed to change the requirements of how routes were designed, that there might not be the same driver day to day. And so we needed to plan for that uncertainty, needed to plan for social distancing in a depot. So only a certain number of people could be arriving at different times. So they had to stagger the shifts. So this is just, another example of the possibility if you had that data science can be applied to help solve a specific resource problem. Please, if you have questions, please throw them into the chat as I go. I'm going to tell you about just one more problem that we are looking to solve, and then I'd love to have a little bit of Q&A if we have the time. So this project with Medic, I mentioned at the beginning that we were talking about data trust. And this is a project around engineering scalable data quality assessments for frontline health. And it started with this challenge. We have a firm belief that all people deserve access to the latest innovations in healthcare delivery. But there's a lack of trust in data collected by frontline workers. So in order to provide first-class care to all people, in order to have precision public health, we need to actually better understand and build confidence in the data that is collected about healthcare. Now, when you think about data quality, often you might think about the data quality, this vicious cycle where inconsistent or problematic data gets created. So if you're, a way to think of inconsistent or problematic data, it's typos, it's missing data, it's putting data in the wrong cell, it's the wrong conversion of data. There's some very famous examples of genetic data being converted into dates by Excel. So you have this process that creates inconsistent or problematic data. People then don't trust that data to be reliable for decision making. Just sort of shrug, it's a lost cause. I'm not going to worry about that data. Since you don't have data that's trusted, there's no comprehensive way of describing what needs to happen next, and the problem doesn't get solved. More inconsistent or problematic data gets created. Thinking back to where I started this talk of, we observe the world, we reason through the world, and then we act. The data quality vicious cycle prevents us from even observing a true state of the world. So what DataKind and Medic started with this project is we actually wanted to define what it meant for data to be inconsistent or problematic. So we wanted to define the dimensions of data quality as they applied to the community health worker situation. Is it timeliness of data being inputted into a system? Is it the correctness of data being inputted into the system? Is it completeness? Once we understood what those issues are, we could then provide interventions to disrupt the data quality vicious cycle, specifically through providing regular reporting to supervisors who could go in to do near real-time remediation. This could then drive better data practices across the ecosystem and increase trust across the sector in the utility of this frontline health worker collected data. In our case, we did a lot of exploration looking at timing of events. For example, birth needing to occur after a positive pregnancy test, looking at the relationships between patients and their healthcare workers, the connections between symptoms and treatments, the connections between data sets. If I have data about you for childbirth and I have data about you for being treated for malaria, can I connect those two data sets and tell the story about you as a patient? And we looked at things like actually the follow-up processes for maternal health visits and just, does this data make sense? And we built this out at a machine level rather than requiring individuals to do this test, because it doesn't help us to explore and test for inconsistent or problematic data if you can't do it across your system. And in this case, DataKind, the art of the possible here, actually able to provide to Medic a suite of 160 tests that can be run automatically, representing the most common community health worker collected data problems. Coverage could be tracked by data source and by test through reports and visualizations. And we're able to provide this in a way that the supervisors could intervene with. So this is a toolkit that sits directly within Medic's workflow. And it's important to note that, again, this is where your leverage points for data science are. And we could say data science can identify and can fix inconsistent or problematic data. But honestly, some data, it's best to be able to handle it at the beginning, so that we actually never encounter that data. So we've worked with our Medic partners to help make changes to a product so that bad data isn't collected in the first place. So you could have rules in your system, so saying, someone delivered 2 babies, but 3 babies are still alive. That can't be true. So building in rules into the system that just allow to that already ensure that true data is being collected. I want to just mention, the application again of this, the ethics components and of these solutions, and working with experts and listening to voices. And that is that identifying potential errors have human consequences. And so we specifically worked with our partner Medic to talk about what does it mean if you're identifying errors. If those errors can be tracked to a person, you're talking about introducing a new way of performance review. And performance reviews can be punitive, but our partner Medic did not want that to be the case. So we wanted to design solutions that had remediation efforts built in. So surfacing this need for a solution and providing the appropriate training, taking on the responsibility as a community to get to better data, not taking on the responsibility of HR, human task remediation, and needed to design this in a way that was comfortable and adoptable for end users. In our case, this means that all of this needs to be able to work in online and offline situations. It needs to be primarily accessible through a smartphone. And lest you think, oh, this can be done overnight, I want to just talk about the thoughtfulness of the replication process for this type of solution. We started this work in 2019. We're now in 2021, where we are working on the Community Health Toolkit as a partner of Medic to build this out as a thoughtful deployment for that health system. So we completed the proof of concept, which were some of the results I just showed you. We're doing a closed beta. It will then open up as an available software deployment for anyone to opt into, and will be a core deployment in another year. So this is a sticking around and ensuring the successful and responsible uptake. I know we're coming up at time, so just some lessons as we talk about the art of the possible, that these solutions can de-risk the space to show that data science, data use isn't scary. These solutions should focus on the critical problems, the problems that keep you up at night. Implementers do not have to be high tech to see the benefits of these data science solutions. Any data science solution that you create won't be successful unless it's overseen, if it's engaged with the end user community. And for DataKind, a learning that we had was partnerships like or communities like this one, like the NYU, the Data for Peace community, are ways to scale your idea, your intervention, to really understand the best practices. So with that, I'll just close by saying, how might we continue to create solutions that serve the good of many? And if this whet your appetite, and if you're excited about this, please reach out to me. At DataKind, we love going through this process with partner organizations. So if you're excited, if you've seen the art of the possible for your organization, please shoot me an email. I'd love to have a conversation about how we might be helpful to you. All right. So I think I have 1 minute left. So for those of you who are just popping in, I know a couple came in through the talk. I'll just share my slides here again and say, thank you so much for having me, and sorry for the technical difficulties at the top, but I look forward to having a conversation with you soon. So please reach out.